My name is Dr. Mojala Mole. I'm a general surgeon and a breast surgical oncologist at Scarborough Health Network. As I said before, the majority of breast cancers you actually don't feel because they're early stage breast cancer. So in terms of what do we do for those, that's why we recommend that women over 50 should be getting mammograms every 2 years. And that all depends on if you don't have a family history or no high-risk lesions in the past. So if you have a family history of breast cancer, we recommend you get it every year, 10 years before the age of the youngest person who's gotten breast cancer. So that's what the recommendation for that. In the US, we know that they start doing breast screenings at 40, and there is some talk here about some high-risk groups, such as Black women, who tend to present with later stage breast cancer or more aggressive breast cancer to start screening at an earlier age. In addition, when we talk about breast cancer, it's good to also remember that in all stages, whether it's stage 1, so it's just localized to the breast, or stage 4, it's gone elsewhere in your body, the survival in Canada is more than 87% in 5 to 7 years. And that is really, really good. That's a testament to all the medications we have developed. So even if you have a diagnosis of breast cancer, it is still very treatable. And in the early stages, we are still going for cure. That's a campaign that's called Know Your Limit, and it is information about what you would notice if you can feel a breast cancer. So you might feel a thick area on your breast. You might feel a dimple in your breast. You might notice some crusting of your nipple and some changes to it that looks kind of scaly and peely. It could be red or hot, your entire breast. Some sunken nipple that kind of pushes down. So if your nipple used to be an outie, now it's an innie. If it was an innie, now it's an outie. Those are the changes that we always ask you about, that are things that you should talk to your family doctor about if you notice. If it has a new shape or it's changed in size, like it's become really larger than before. And when we say over time, where I'm talking about months, not over years. Also, if it looks like it's an orange peel, it's with a dimpling, those are also things of concern. And also if you feel a hard lump in your breast. So if you recognize any of these things, don't panic about them. Some of these changes can be normal, but if this stays around over a few weeks, then you should let your family doctor know, and we'll get appropriate imaging. They'll get appropriate imaging and refer you to someone like myself, a breast surgeon. When we talk about what treatments are there for breast cancer, so there's always 3 prongs to the treatment of breast cancer. There's what we do to the breast, so that's what we call the local treatment. And so that's when we talk to women about just taking out the lump, which is the most common form of treatment for breast cancer, or taking off the entire breast. That tends to be reserved for much more aggressive cancers, bigger cancers, or if there's a family history of breast cancer and you have a genetic abnormality, it makes sense to just take off the whole entire breast. But the majority of the time, we just take out the lump with some normal breast tissue, and then we recommend for women with the lumpectomy to have radiation after, which is 3 to 5 weeks. Radiation is every day, but it's only about 20 minutes, and it's really well tolerated by women. It doesn't cause you to lose your hair. It doesn't cause you to be excessively tired. It just feels like a sunburn to the skin. Those are the main symptoms of it. And then we also talk about what do we do with where breast cancer goes. So breast cancer likes to go to the armpit. So at the time of surgery, just as you have glands in your neck, you have them underneath your armpit. And at the time of your surgery, we check them at the same time too. And then the last part of your treatment is what do we do for the whole entire body? So most common cancers that we notice in women respond to both estrogen, to people in general, respond to both estrogen and progesterone. So that means that if we give you a whole bunch of estrogen and progesterone to eat, like hormone replacement therapy, that cancer would grow. So what we do after is we give you medication to suppress the effects of those. The other thing that we always notice with breast cancer is, does it have a special protein called HER2/neu? When you have this protein, it does mean it's a bit more aggressive of a cancer, but we have treatment for it, which kind of neutralizes that position. So that usually is a year of treatment that you're with that, and that's always given with chemotherapy. Chemotherapy is not a common treatment for breast cancer. And it's really reserved for breast cancer that has, as I said, the HER2, or the ones that don't have the HER2 and don't have hormones, which we call triple negative breast cancers. These tend to be more aggressive, they tend to present at a younger age, and they tend to present in Black women and people who have a genetic abnormality for breast cancer. Those are the patients who need to have chemotherapy as part of their treatment. So that's pretty much kind of sums up the 3 treatment arms and what I talk to patients about when they come in with a new diagnosis of breast cancer. In all of these, we're still always trying to cure your breast cancer until this time when if it's gone too far that we can't do that. But that said, even women who have cancer that's gone to their bone are living very long and productive lives. So even with a diagnosis of breast cancer, it's always important to realize that we have a lot of treatment to help with it.